Hi, I'm John. I'm one of the physio team.
Hi, I'm Sian. Nice to meet you.
Thanks for coming in to physio today. I wonder if you can tell me a little bit about what's been going on for you, what's brought you into our service.
Yes, I've been getting some shoulder pain for the last kind of 2 to 3 months. I'm not sure why it's kind of come on. I tend to kind of find that when I'm kind of lifting my arm kind of up, it's quite painful. Things like kind of brushing my hair. I'm struggling with swimming. Yeah.
So kind of 2 to 3 month history, left shoulder pain, and struggling with certain activities at the moment.
Yeah.
So you mentioned left shoulder pain. I wonder whether you could show me where you seem to experience that pain.
Yeah, so it seems to be kind of around this point here.
So top of the shoulder, and if you would describe it, it's quite difficult to do, isn't it? But if you describe what type of pain, how does it feel?
It's kind of like a dull, constant ache, but I do get kind of shooting pain, kind of electric shock type pain.
Okay, so a kind of dull pain most of the time, but then some shooting pain at times.
Yeah.
And again, difficult to do, but we tend to get people to rate their pain 0 to 10. 0 is no pain at all. 10 is the worst pain you could imagine. Where would you say that left shoulder pain seems to be for you at the moment?
I'd say kind of the constant ache would be around a 3 out of 10, but it does go up to 8 out of 10 pain on that kind of shooting pain. And I do kind of struggle to sleep as well with it sometimes.
Right, so kind of sleep's disrupted by it quite often. And during the rest of the day, is there any pattern of the pain at all?
There doesn't seem to be a pattern, but it does tend to be a little bit worse if I do more with it.
Okay, so increased activity seems to worsen it. So is there anything that seems to aggravate your shoulder pain?
Yeah, so kind of lifting my arm above my head, so particularly kind of getting into cupboards and things is quite a struggle for me.
And is there anything that seems to ease your pain at all?
Paracetamol seems to help. Using a hot water bottle at night is quite relieving.
And do you get any pins and needles or numbness or any sensory changes down the arm out of interest?
No, thankfully I haven't had that.
Okay, so that's encouraging. But in terms of your understanding of what's going on, I don't know whether you had any particular thoughts or whether your GP has said anything so far?
No, I'm not sure. I'm just hoping it's nothing serious, that's all.
Well, hopefully our assessment today can rule out some of those concerns. So in terms of coming into physiotherapy, I wondered whether there was anything particularly that you'd like to get from seeing us. What matters to you most?
So I guess I'd like some reassurance really, and to find out what the cause of the pain is, and perhaps kind of some exercises to help rehab.
Okay, so some reassurance, maybe some exercises and a bit of guidance with that. And did you have any particular goals, things that you want to get back to doing that you used to enjoy doing?
Yeah, I'd really like to get back to swimming, and I really enjoy dog agility with my dog, so I'd like to get back to that as well.
Okay, so hopefully as we work together we might be able to work towards those specific goals. So just to ask some further health questions, have you had any surgery in the past?
Yeah, so I did have a mastectomy about 5 months ago for breast cancer, and it's quite frustrating really, because I was just starting to get back to normal, and then my shoulder starts hurting again. So
sounds like that's been a really difficult time for you recently then.
Yeah.
Okay. And in terms of medication at the moment, you taking anything from a medication tablet point of view?
Just taking paracetamol.
Okay, so just paracetamol to manage your pain. And have you taken any steroids or blood thinning medication at any stage over recent times?
No, nothing like that.
No, okay. And any other kind of changes in your health, like sudden loss of weight?
No, nothing
No,
like
and
that.
you're feeling well in yourself generally?
Yes. Yeah.
Okay, that's good to hear. That's reassuring. So just to get a little more understanding of the kind of things that you like to do day to day, are you involved in any employment or any particular hobbies, activities that you like to do?
Yeah, so I work as a secretary full-time in estate agents. I also really enjoy swimming, so I was doing that 3 to 4 times a week, but that's stopped now. I also enjoy doing agility with my dog and do quite a few competitions with him, although that's been getting quite difficult because it's quite painful when I'm running and trying to kind of point to where he needs to go, it becomes quite painful.
Yeah. Okay. So hopefully as we start to assess it now, we'll look at it physically, we'll get a better understanding of your movements and hopefully come up with a plan together to help you moving forward. Is that okay?
Yes, that's great.
So would it be okay if I have a look at your movement just to get a bit of a sense of how that shoulder's moving at the present time? Is that okay?
Yeah, that's fine.
So what I want you to do with that left shoulder is just take your arm up as if you're reaching right up above your head as far as you can comfortably go.
Yeah, that's about it.
That's about it. And is it okay if I just give some overpressure just to see? So it's quite stiff, and that's also painful for you.
Yeah, it's quite painful there.
And then lower it down again. And with the other shoulder, I'm presuming, yeah, easy range of movement, no pain with that.
No.
And with that arm, if you take the arm out to the side, as if you're taking it out again as far as you can comfortably go, is it okay if I put some overpressure on that?
Yeah.
And again, there's quite a lot of resistance there, isn't it? That's quite painful for you. Okay. This one's a bit more difficult to do. If you put your hands like that into that position, can you rotate your arms out to the side? So it's easy on that side.
Yeah.
And what's happening here?
Again, it's quite kind of stiff and painful.
Yeah, it's quite restricted again. Okay. And the final movement, can you take your hand behind your back? You might need to stand in that direction. So again, what are you feeling as you do that?
It's quite uncomfortable.
Okay. And if you compare it with the other side, so take that one down. Okay, so it's easier on the right side.
Yeah.
Okay, and then if you stand to face me this way here, final thing, just to check your neck movements, turn your head as if you're looking round towards that way, and then round towards the other way. How do those feel as you do that?
That feels okay.
And if you look up to the ceiling as if you're taking your head right back, and then look down to the floor, and then back to the centre. Any problems as you do that at all? Feels comfortable for you? And if you bend the arm up like that, and then if you straighten your elbows, any pain doing that at all?
No.
Nothing at all. It's okay if I check the muscle power now. So if I just get you to stand just into that position, and I'm going to get you to push out against me as hard as you can comfortably go, and then let it relax. Any pain doing that at all?
Not too painful.
Not too painful.
Little
Feels
bit
okay.
uncomfortable, but...
And if I take you into that position, can you push against me here? And then can you pull in against me this way? Any pain doing either of those at all?
Feels okay. Feels
Okay. Good. So we've had a look at your shoulder and taken some time to get a better understanding of what's happened to you. And I think what you seem to be experiencing is what we call a frozen shoulder. I don't know whether you've heard that term used before.
No.
So frozen shoulder is one of those strange conditions. It comes on for no particular reason, often not after any trauma. Tends to affect the shoulder capsule, the area that surrounds the shoulder itself, almost becomes inflamed, and then the capsule tightens. And that's why you have that classic loss of movement. It's not frozen as in cold, but it's frozen as in the lack of movement there. What we know with the frozen shoulder, the good news is it's not due to damage or disease process, and it will improve, but it can take a long time. It's not uncommon for it to take a year, even 18 months of time, and it slowly gets better, but often goes through 3 key phases of time. Does that make some sense in terms of an understanding, or do you have any questions about that?
Yes, that makes sense, thank you.
Okay. So in terms of how we manage a frozen shoulder, there's no magic fix, unfortunately, but there are a number of things that we can do that hopefully will help you in moving forward. For some patients, they just want advice and guidance. They're reassured. They want to go away and manage it for themselves. Some patients want some ideas on exercises, things that they can do to help them move forward. or maybe other advice that we can give to support you. I don't know whether you have a particular preference for you as to ways you'd like us to help work with you on this.
Yes, some guidance on exercises would be really useful, thank you.
Okay, so in a moment I'll show you some exercise ideas, things you can be doing at home. I suppose the other thing to say is in terms of managing your pain. You mentioned that you're taking paracetamol at the present time.
Yes, that's right.
How's that working for you in terms of managing your symptoms?
That provides some relief.
Yeah. I mean, there are a couple of options. You could just continue to take paracetamol, regular dose within the prescribed amount. Some people can take ibuprofen. I don't know whether that's something that you've used before.
No, it's not, no.
Ibuprofen is an anti-inflammatory and it can be used alongside paracetamol or by itself. We tend to suggest that you talk with a pharmacist just to make sure that it's the right medication for you. But that could dampen down your pain to help you to do some of the exercises and to start to get more activity in the shoulder. Would that be something you'd like to explore a bit more?
Yes, that'd be good, thanks, yeah.
And are you doing anything else to manage your pain? Some people use heat or cold. I don't know whether those are things you're doing at the present time.
Yeah, just a hot water bottle really. That seems to give a little bit of relief at night.
Yeah, so heat can be useful, and some people put it either side of the shoulder, even before they do exercises, almost to warm it up. Sometimes people use cold, and really it's a personal choice. There's no kind of hard and fast rules behind it, but that would be worth thinking of. The other thing to say is that occasionally, if you're really struggling, waking up at night and the pain levels are high, you might want to consider a steroid injection. I don't know whether that's something you've considered at all.
No, that's not something I've thought about. But...
So a steroid injection is really there predominantly to help you in managing your pain. It doesn't have any effect on the whole body, and it really helps with inflammation in the shoulder itself. It's not always our first port of call, so I don't know whether that's something you'd rather work on exercises first and leave that as something for extra. I don't know what your thoughts are at the moment.
Yeah, I think I'd like to try the exercises first, and perhaps if that doesn't work, then maybe kind of explore that as an option.
We can always come back to use a steroid injection at a later stage, and that's something we can do within our service as well. So would it be helpful if I show you some of the exercises that might be useful to do at this stage?
Yes, please, that'd be great.
So hopefully the exercises give you a bit of a sense of the kind of things you can be doing at home. In terms of taking it on from here, I don't know whether you had any thoughts in terms of whether you'd like to come back, whether you'd like me to give you a phone call. What would be most helpful for you in terms of follow-up from here?
It might be quite useful to just to have a bit of a follow-up, just to kind of make sure things are heading in the right direction, and perhaps, any further advice on any of the exercises that I can carry on with.
So if we book a follow-up, would that be helpful to do that face-to-face so we can go through the exercises in some more detail? Would that be helpful for you?
Yeah, that'd be great, thanks, yeah.
So if I book that, timescale-wise, I suppose we're going to want you to do that for a few weeks to get you started and at least get a sense of what's happening. So should we book that for about 3 weeks' time, something along those lines?
Yep, that sounds great.
And what I'll do in the meantime, I'll send you out an email with all the exercises there to remind you of what you can be doing. If at any stage over the next few weeks you have any concerns, any problems, you can obviously phone our booking office and we'd be more than happy to see you again.
Brilliant.
Were there any other questions or anything that I haven't covered today that you wanted to make sure that we talk about?
No, I think that's everything. Thank you very much.
Brilliant. Well, lovely to meet you and look forward to seeing you next time.
Thank you.